Jonathan. Today we're going to do a serratus anterior block. What we aim to do is instill local anaesthetic to do a field block, which will block this whole area. And the way we do it, we position our patient with their arm behind the head or the arm extended upward, use a linear probe and use a nerve block needle. We need sterile prep. We're using 0.75% ropivacaine, 20 mils, diluted into 2 syringes with saline. So I've got a total of 40 mils. The landmark is over the 5th rib in the mid-axillary line. The block's going to go in just superficial to the serratus anterior, just where the latissimus dorsi wraps over. So that's going to be our spot. I use my linear probe and I'm going to drop down until latissimus dorsi comes into view. I'm going to put some local anaesthetic in, just to anaesthetise the skin. Then I'll grab my nerve block needle. I'm using an in-plane approach. I'm going to track my needle down until it sits over the serratus anterior, over the 5th rib. Be mindful to avoid the thoracodorsal artery, which will appear to pulsate. I'm going to put 2 or 3 mils in just to hydrodissect to make sure I'm in the correct plane. When it looks like the plane between the serratus anterior and the overlying musculature is being infiltrated by the block, I'm going to slowly instill the full volume of anaesthetic, and it's probably going to be 30 to 40 mils of diluted solution. Once that's done, remove the needle, and we expect the block will take effect in about 10 minutes. Serratus anterior block. Have the patient's arm extended. Use the linear probe and the nerve block needle. We use 20 mils of 0.75% ropivacaine diluted to 40 mils. The landmark is the 5th rib at the mid-axillary line at the edge of the latissimus dorsi muscle. First anaesthetise the skin with 3 to 5 mils of 1% lidocaine. Place the needle so it lies over the serratus anterior, over the 5th rib. Hydrodissect to confirm the plane. Then instill 30 mils of the diluted ropivacaine solution. And that's the serratus anterior block.